Margaret Taoiseach, the healthcare sector is one sector of our public service that relies heavily on attracting and recruiting practitioners and staff internationally. In 2024, 6,000 of the 17,000 critical skills permits provided by the state were in the health or social work sector, 5,031 of which were for nursing staff. In the 2023, the OECD said that 54% of nurses who were working in Ireland had trained in other jurisdictions. The equivalent figure in the UK was 18%, and I would harbour a guess that many of them are probably Irish. I suggest that there are two conclusions that I arrive at from this Taoiseach. One is that we are not training an adequate number of healthcare professionals and practitioners, particularly nurses, and secondly, that nurses particularly are choosing post-qualification to seek opportunities internationally in countries other than Ireland. And I think that both of these conclusions, Taoiseach, need to be interrogated.
Thank you, Deputy.
Deputy Connolly mentioned nursing and 6,000 critical skills permits and 5,000, I think you said, were nursing. There's two ways of looking at it. I think a lot of young graduates travel and have been travelling for a long time in the medical world. There may be an issue of retention. Some come back to work in Ireland later on. And there's huge specialties now available to nursing in Ireland. Huge programmes of postgraduate programmes, specialist programming. And we've developed that very well with native talent, by the way, in terms of intensive care nursing, cardiac nursing. It's been phenomenal over the last 20 years. It's been phenomenal change in nursing in Ireland from the degree programme onto the postgraduate programmes. But there is an issue of retention or training people. And I think we have to be more innovative in terms of how we do that into the future. And we then attract nurses in from other jurisdictions into the country.